Welcome, everyone. It looks like folks have stopped signing in or it's slowed down a bit, so we'll go ahead and get started. I appreciate your patience today. My name's Kim Brown, and I'm with the Rural Institute Transition and Employment Projects. I'll be your moderator and your presenter today. Today's webinar is sponsored by the University of Montana Rural Institute Transition and Employment Projects in partnership with Children's Special Health Services at the Montana Department of Public Health and Human Services. All attendees are currently muted. That helps cut down on background noise so that you can hear me better. If you'd like to ask a question when we come to the question and answer time, you can type your question into the chat box, and you should see that up on your screen. I am going to ask you to hold your questions until the end of the presentation, if you can please do that. You can go ahead and type your question in if you want, but I won't be reading and answering them until the end of the presentation, just because I'm both moderating and presenting today, and I don't want to get myself lost. So I do appreciate your patience with that, but I will be having time for questions at the end. For those of you who requested Montana Office of Public Instruction renewal units when you registered, we will email those out to you after the webinar. It generally takes a couple of weeks to get those out, and you do have to have pre-registered in order to receive the Office of Public Instruction credit. Please note that we're currently unable to issue any other kinds of attendance documentation. Today's session is being audio taped for the Rural Institute Transition and Employment Projects Resource Library and for the Rural Institute Pluck Online Transition Toolbox. And those addresses will be on the final slide of the presentation. And so you can copy those down if you'd like and take a look at the websites if you want to view the presentation later, listen to it, or share it with other folks. We'll also be sending you a survey link after today's session. It's a very short online survey. We do ask that you take the time to go and complete that. We pay close attention to all of our survey results, and we try to incorporate the feedback that we receive into future webinars. So let us know how today's session went for you, what other kinds of topics you'd like to see us covered, anything that didn't work so well for you, and we'll take that into account for our future sessions. And with that, I'd like to thank you all for joining us today, and go ahead and get started with our webinar, Using Portfolios for Healthcare Needs. My name again is Kim Brown, and I'm with the University of Montana Rural Institute. So the portfolio was initially developed as a job development and representational tool, and it was used to negotiate customized employment, and still is used to negotiate customized employment primarily for people who have a significant impact of disability or other challenges to employment that make traditional going out, applying for jobs, attending interviews not work so well for them. And so the representational portfolio was developed for use in those situations. And then its use kind of evolved into other directions, including using it at IEP or individualized education program meetings, and in other settings so that an individual could introduce themselves to new teachers, new service providers, new developmental disabilities case managers, new personal care attendants. It's also a great way for young people to practice self-advocacy skills as they introduce themselves to new folks in their lives. But portfolios can be a fantastic tool for describing healthcare needs, especially when young adults are transitioning from high school to adulthood, and they're moving from their pediatricians and their pediatric care providers into the world of adult care providers. This is a way that they can, both visually and in text, and we'll show you how that works through the presentation today, visually and in text, they can introduce themselves to their adult care providers. They can even go out and interview adult care providers and decide who they want to use as they move away from the pediatric world. Younger children can also start to use portfolios. It's a great way to start to develop health literacy, help younger children learn to describe what their disabilities are, what the impact of their disabilities are, what medications they take, what kinds of healthcare services they need. It's a great way for young children to start practicing self-advocacy skills. So really we're seeing the uses of portfolios continue to expand in new and really exciting ways. So what are some reasons that you might want to use a portfolio for healthcare? Well, as I mentioned a few minutes ago, it's one way to help develop health literacy. It provides a concrete tool that individuals can use to describe their healthcare needs and to describe the healthcare services that they require. And as a result of practicing going through the portfolio, as a result of developing the portfolio and deciding what information and what photographs to include in it, people learn a lot about their own healthcare needs and they become more literate. Portfolios also, as I mentioned, allow for self-advocacy and also for self-determination regarding healthcare needs, because a person can take their healthcare portfolio out with them, interview prospective providers, decide what kinds of services they want their healthcare providers to offer, select which providers they believe are going to be able to offer the things that they want and need. It allows them a way to show if they aren't able to use words, if they aren't able to communicate verbally as easily, they can use the portfolio, to express what their wants and needs are with respect to healthcare. So it's a great self-advocacy tool. Portfolios help facilitate the communication of healthcare needs even in some areas that can be a little less comfortable for people to talk about. For example, sexual health. That's a really important topic, especially as young people are transitioning into the adult world, and it's something that often gets overlooked as they move to adult care providers because it's people, as I said, they're sometimes kind of uncomfortable talking about sexual health. But clearly, as we're moving, into the teenage years and beyond, it's a big issue in most people's lives. It's a big topic. It's something that we really need to be able to discuss. And with healthcare providers, it's important to be able to talk about reproductive health, about relationships and how you can keep safe in relationships and keep your body safe and well. And so portfolios are a way to initiate conversations that may be a little uncomfortable to initiate without a tool in front of you, without a picture and text portfolio. It's also a tool to ease the transition to handling one's own medical affairs. So if you're a young person and mom or dad have always made the doctor appointments for you, they've always gone with you to the pediatrician and told the pediatrician what kinds of medical issues you've been having lately, the pediatrician explains some of the options for treatment, mom or dad make the choices. All of those are things that as the young adult moves into assuming responsibility or more responsibility for his or her own medical affairs, the portfolio can be a tool to help them do that, to help them express what some of their treatment needs are, some of their medical issues, some of the options that they would like to see available to them, some of the options they've already selected. And again, I'll give you some concrete examples of these as we move through today's presentation. Portfolios can help ease the navigation of healthcare services. When you're a young adult and you're moving to a whole new set of providers, not just for your medical care, but also for case management services possibly, you're leaving school and the different services that were available there, so you're moving into this very unfamiliar, really big world with lots of different choices and options. And sometimes it's hard to know which direction to turn. It's hard to know who you've already shared certain information with. It's hard to know if you're repeating yourself, if you're leaving out important information. If you have a portfolio where all of the critical information about your healthcare needs is captured, then it eases some of that anxiety. You can take it with you as you navigate all these different new and unfamiliar terrains with respect to healthcare. It's a great way to describe the impact of disability in very positive terms. So instead of just providing the medical label or the disability label, the clinical label, in the portfolio, you actually describe in words and in pictures what the impact is. How does this person still get around and conduct their daily living activities? What supports work for them to successfully get around in their community, to successfully get through school and learn? What kinds of supports help them to communicate? All of those things can be described in really positive terms in a portfolio, and the pictures help enhance the positive language that you're using. And I've mentioned several times that portfolios can be used as a tool for interviewing prospective healthcare providers. So if you are going to be transitioning from pediatric care into the adult world, and you want the opportunity to choose your new provider, which I think is really important. You want someone you feel comfortable with, someone who you think understands your needs and will listen to you, will pay attention to what you want. Then you ought to have the opportunity to go out and interview some of those providers. Using the healthcare portfolio, you can introduce yourself and say, here are my healthcare needs, here are the healthcare services that I've received in the past, here are my medications, here is the medical equipment that I use to conduct my daily living events and affairs. How would you work with me on these? What do you think about these medications? How would you be able to provide the supports that I need in order to stay healthy and in order to live as independently as I want and can in my community? And then based on the answers that the healthcare providers give you, you can decide who you want to provide your adult healthcare services. So it's a great tool for self-determination. Before I move into some examples, I'd like to just tell you a little bit about the nuts and bolts of creating a portfolio so that you can see how simple these really are to create. And they're a tool that can be collecting pictures, deciding what to modify, update, expand it as the child ages. And then by the time you get into the preteen and teenage years, many teens, they can get on the computer and develop the PowerPoint or other presentation software slides that we use for portfolios. They can put the printed pictures into clear plastic. Folks can get in making their own portfolios, the more invested they are and the more it becomes truly a tool for them. So just a basic supply list, and this can change depending on how you want the portfolio ultimately to look. But use a standard non-digital camera and just have the pictures developed onto a CD or a DVD or put onto a flash drive. But you need a way to get the pictures from the camera into the computer. In order to do that, you might need a USB connector or some other means of saving and transferring the data from the camera to the computer. When you're out taking pictures, charged batteries, it sounds like a no-brainer, like I shouldn't even need to mention that, but I tell you what, I've been out there working on portfolios too many times and forgotten to take charged batteries and miss those great shots. So think about that ahead of time. We use MS PowerPoint or some other presentation program in order to create the slides for the portfolios. You can find other ways of doing it, whatever works for you and is comfortable for you. We found PowerPoint to be really easy, but again, whatever works for you. A presentation binder with clear sheet protectors, and I'll show you a picture of a presentation binder type that we've used for a lot of years, just to give you a picture in your head of what that might look like. And then a color printer so you can print out the individual pages or slides from the portfolio. So here's an example of a presentation binder. They look like just regular 3-ring binders from the outside, but then they unfold into easels, so you can stand them on a tabletop and flip through the pages as you present the information to the healthcare provider or whoever you're using the portfolio to introduce yourself to. And you can find those at different office supply stores that are available online. They usually run anywhere from $18 to $35, depending on what quality you want. If you're going to be using the portfolio a lot, get something that's decent quality if you can, so it doesn't fall apart real quickly. And then some step-by-step instructions, I guess, or guidelines, sort of the recipe for creating a healthcare portfolio. First and foremost is deciding on the purpose of the portfolio. If this is for a younger child, are you developing or helping them to develop the portfolio as a way of starting to develop that health literacy, as a way of helping them begin to learn self-advocacy skills? Are you developing the portfolio to introduce yourself to a new personal care attendant, to a new nutritionist, to a new physical therapist, a new teacher, a new nurse practitioner? Or are you using the portfolio because you are looking to interview a new healthcare professional? Maybe you're not pleased with the services that you're currently receiving and you want to look for a new healthcare provider, and so you want to create a portfolio for yourself in order to help you go out and interview providers. So decide on the purpose first, because that kind of shapes what you want to include in the portfolio, what kind of pictures you need to take, how long you want the portfolio to be, those sorts of things. And along with that is determining the possible audience. Again, are you developing something for a teacher, for a doctor, for a physician's assistant, for an occupational therapist? It makes a difference on the kinds of information and the language that you use. It's helpful then to draw up a little outline of the areas that you want to cover in the portfolio. These are things that you think are important to communicate to your intended audience. So if I'm going to be presenting a portfolio about myself and I'm going to use it to go out and interview a new primary care provider for myself, and I don't know if I want that to be a physician or if I want it to be a physician's assistant or if I want it to be a family nurse practitioner. So I want a portfolio that I can use for any of those three kinds of medical professionals. And I know that things that are important for me to cover in there are my hearing impairment, my medication needs and how long I've been on the meds and how often I take them and what they are and those kinds of things, my scoliosis and what impact that has on me. And so I outline ahead of time what are the critical areas that I think need to be covered, because these are areas that will come up, or most likely will come up, in future conversations with my new healthcare provider. So I want them to know about these areas of my life, and I want to know how they're going to help support my healthcare needs in those areas. That's going to be part of my interview. So I want to outline that ahead of time. I want to make sure I don't miss any important areas. And then because the portfolios include both photos and written information, usually in the form of bullets, so that it's really quick and easy to read, take pictures, lots of them. And these are pictures that represent the information you want to include in your portfolio. So going back to my own example again, if I want the providers to know about my hearing impairment, I might show myself reading somebody else's lips to show that that's one of the ways that I deal with my hearing impairment. Regarding the scoliosis, if I were currently wearing a back brace, I would probably have a picture of my back brace and some information about it and how long I've used it, the curvature of my spine, those kinds of things. So I want pictures because they make the portfolio more interesting, for one thing, but for another, pictures provide a wealth of information. For example, if I'm talking about a back brace for scoliosis, there are many, many different kinds of back braces, and they're shaped very differently depending on what kind of curvature you have, the degree of curvature, etc. Somebody who's familiar with back braces, a healthcare professional, can take a look at that, at a photo, and get a wealth of information just from the picture. And one of the things, just in talking to a number of different healthcare providers, that's become really clear to me is that as more and more medical information is being stored electronically on computers instead of in hard copy files, and as providers are getting busier and busier and having less and less time to see patients, they don't have a lot of time to get on the computer and scroll through page after page after page after page of medical files that have been digitalized and saved on their computer system. They just don't have time to do that. And so if you can have a portfolio with pictures, quick bulleted text that gives really key information, that lets them know the areas that they especially might want to pay attention to when they go in and try and read through your file. Ah, yeah, scoliosis is an area that I definitely want to look for in her file and get some more specific information about what kinds of treatments she's already had, give me some ideas about where I might want to go next. The next step would be to actually create your slides using whatever presentation software you've chosen to use. That would be like PowerPoint or whatever presentation software. And then print those slides out in color, one slide to a page, because you want them to be big, easy to read, easy to flip through in that presentation binder that I showed you a picture of a bit earlier. Once your color printouts have dried, put them into your display binder and then practice presenting the portfolio. Go through it and see how it flows. When you go through it, you may realize that you've forgotten some really important information that you want to go back in and add. You may realize there are some things in there that you're not quite ready to share, and you want to pull those slides out and save them for a while until you're more comfortable with your new provider, if you're in the process of transitioning into a new provider, for example. And also, you don't have to print out your portfolio and put it in a presentation binder. there are folks out there now who are keeping their portfolios on a laptop computer or on an iPad and carrying that around and using that as their presentation method. So they aren't printing it out at all. That way they're saving paper and ink, and it's a lot easier to go in and make last-minute changes. The caution with that is that, first of all, it relies on your laptop having a battery that's not going to die in the middle of your presentation, or your iPad being fully charged. It relies on the screen being easily viewed, which isn't always the case depending on the lighting where you might be presenting. You know, if it's really bright, it's hard for people to see the computer screen sometimes. So, and maybe part of that's just my old-fashionedness, but I like the physical ability to flip through the pages on the portfolio and have the nice bright pictures there. But, you know, if you're more comfortable with it on the computer, absolutely that's another way to share your portfolio. Now we'll go into talking about some of the areas that you might want to cover in your portfolio, or if you're helping somebody else create their own healthcare portfolio, these are areas you might consider suggesting that they address. And not all of these will apply to everyone. So you're just going to look at the areas that apply to you and the areas that you feel are a priority to share information about with the new provider or the prospective new providers. Examples include the impact of disability. As I mentioned, rather than just saying that you have cerebral palsy or you have Down syndrome or whatever that might be, going in and describing what that looks like for you. What is the impact? So I use a power wheelchair for mobility. I use an augmentative communication device called an Echo to communicate with the people around me. Describe what the impact of your disability is and what supports help you to navigate the world. You can include previous diagnoses if those are applicable and relevant. So, for example, I have a history of cancer. So if I'm doing a portfolio for myself, I'm going to include that. It's not something that's relevant right now in my life, but it certainly was years ago, and I think it's really important that doctors know that. So even though it's not a current diagnosis for me, it's something from the past that's really important. I'm going to include information about that in my portfolio. Medications is a big one, because whatever medications you're on right now, you may not think that those impact all the areas of your life, but they very well may. And so it's really important for healthcare providers to know what kinds of medications you're on. And not just the name of the medication, but your understanding of what it does, how long you've taken the medication. Have you been on it for 20 years, or is it something you've only been taking for 6 months? Any side effects that you are experiencing or have experienced from your medications, who's been prescribing them, what they typically cost you, the pharmacy that you use, and some of those last ones, again, they may not apply for every portfolio, but if you're a young adult and you're just transitioning out and you're going to be living on your own and you're going to take over your own health care, that might be really helpful information for you to have in your healthcare portfolio, because it helps you remember that. It helps you become more literate about your own healthcare. Where do I get these medications? How much do they generally cost me? Who's prescribing them for me? Is it my doctor? Is it my psychiatrist? Is it my nurse practitioner? You know, those sorts of pieces of information can be really useful to you. Allergies. If you have any allergies that you want your healthcare providers to know about, medication allergies in particular, those are critical to have on there. Latex allergies, bee sting allergies, things like that, that could really result in critical emergency situations. It's important to include those, and then other allergies as well. If you have seasonal hay fever and things like that and you want the doctor or other healthcare provider to know about that, by all means include it. If you have any dietary restrictions, include those in the portfolio. Seizure information is another one where you want to provide really good information about your seizure history to current and potential healthcare providers. So what kinds of seizures do you have? Do you have the grand mal? Do you have petit mal? What sorts of seizures? How long do your seizures typically last? Are they just microseconds, or are they 2, 3, 4 minutes long? How often do you have the seizures? And how do people help keep you safe when you're having seizures? Do they just need to move everything that's in the area around you away so that you don't bump into or accidentally hit or kick something that might injure you, or are there other things that people need to do to help keep you safe when you're having seizures? And then are there specific things that people need to do in order to help you after a seizure? Do you need a certain amount of time to just have quiet space to kind of rest and regroup? Do you need to go sleep for 3 hours? What is it that will help you come back and recover after a seizure? If you use any medical equipment, include information about the medical equipment in the healthcare portfolio. And examples of medical equipment might include things like feeding tubes, oxygen tanks, etc. Information you might want in there could include who maintains the equipment for you, who refills or recharges it, like if it's an oxygen tank that you're using. What happens if the equipment fails? What is the backup plan? It's good for providers to see what your backup plan is, and if you don't have a backup plan, then that might be part of the discussion that you have with your healthcare provider, is what sort of a backup plan is appropriate and reasonable, manageable, doable, etc. What are the accommodations that help you manage? What are some of the modifications in your daily life? What are some of the pieces of assistive technology or adaptive equipment that help you manage? And communication strategies that work for you. And I'll give a number of examples of these in the upcoming slides. So here are some examples, and I'll tell you ahead of time that typically when you're doing a portfolio, you want to include a lot of pictures. In the examples that I'm giving you here, you're not going to see a ton of pictures, and part of that is just for student privacy reasons. And some of the pictures you'll see in here, I have people's heads cut off, and again, that's for privacy reasons. Obviously, you're not going to do that when you're actually creating your healthcare portfolio. You're going to want to make sure you have heads and faces and those kinds of things in there. So just bear in mind as you're looking at these examples that if I were really including these in a healthcare portfolio today, I would have a lot more pictures. But I wanted to give you the actual text that we've had in portfolios before so you could see that, and then just I'll tell you what some of the sorts of pictures you might have seen on these slides would be. This is an individual who has scoliosis. So they've included, I wear a back brace to treat scoliosis or curvature of the spine, and because of back surgeries, I have to avoid physical contact and can only bend a small amount. Now, if this individual is going to be seeing a healthcare provider and this is a portfolio that they want to use to introduce themselves and their healthcare needs to that new provider, the next slide that follows this one would probably have more specific information about the scoliosis. 60 degree curve to the left, for example. Have been wearing the back brace for the last 5 years, 3 surgeries in 1998, 2003, 2007, etc. So I would probably follow up this slide with a bulleted one with a little bit more information about the scoliosis. But this is the introduction for the healthcare provider. Here's an individual, a young man who has diabetes, and he wants to show his healthcare provider that he's conscientious about managing his diabetes. He knows how to check his blood sugar level. He knows that when his blood sugar level is low, he needs to eat a healthy snack in order to help bring it back up. And again, I would follow up this slide with some additional information about how far his blood sugar levels typically fluctuate. Is he someone who goes from 30 to 300, or is he someone who typically stays in a little less broad range? I'd also want to give information about insulin and how often he takes that and those sorts of things. But this is the introductory slide, just letting the healthcare provider know that he understands he has diabetes. He understands there are certain things that he needs to do in order to keep himself healthy and keep the diabetes in check. Now here's a slide where we would probably start with a photograph of the individual eating, and I've removed that photograph, but I'm giving you some of the text that followed it up. Fine motor skills for this young man are still developing, so feeding presents some challenges. And this might be a slide that you would want to share like with an occupational therapist, in addition to other healthcare providers who would be just wanting to get to know this young man and who might be starting to work with him. During meal times, he sits in a wooden chair, lifts me closer to the tabletop. I need my food cut into bite-sized pieces. I'm not going to read all of these, but I'll read a few of them for those of you at home who might not be able to see the slide in front of you right now. I drink best with a straw. I need to be reminded to take small bites. I have 2 chipped teeth, so I need to be careful with spoons and other utensils so that I don't damage the teeth more. Okay. And then this individual wants to share some information about how he communicates, because he doesn't use verbal words the way that many of us do. And so some of the ways that he communicates include facial expressions and sounds. He has certain sounds that he says when he's happy, sounds that he uses for mom and no and yes. He may tap on or reach for things that he wants. He may hit his head or cry when he's in pain or upset. He grinds his teeth when he's anxious, and he slaps his leg when he needs to use the restroom. So these are things that if he is in meeting with his new healthcare provider and the healthcare provider is just starting to get to know him, now the provider is going to have a list of some of the basic ways in which this young man communicates. So he knows if the young man is slapping his leg, okay, the restroom is just down the hall. Can I point you to in the correct direction? So communication strategies and the communication dictionaries are really important to share for people who communicate maybe in less traditional ways. Challenges that I have and supports that work for me include I like to explore, and I'll sometimes run off if no one is watching me. So that means if I'm in the doctor's office, don't just leave me alone while you go off to look at x-rays and things. I need to either have somebody with me or somebody keeping an eye on me. Use light physical contact, like putting your hand on my back or shoulder when we're out doing things around town. And then it talks about some of the boundaries that work for him. He needs tangible boundaries that are at least 2 feet off the floor. So, he could have a boundary put across the doorway of the doctor's office, and as long as it was at least 2 feet high, he would know that he needed to stay in the office. So those are just some bits of information to share with potential providers or new providers. Some additional challenges and supports that work for this young man. Needs to be reminded on a regular basis, which means every 90 minutes or so, to use the bathroom. It helps when people encourage me to drink plenty of liquids and eat fruit. I'm using the Roll and Control program to gain more control over my bodily functions. I wear a medicine patch behind my ear to help keep the excess saliva in my mouth. And sometimes I wipe my chin, but I may need someone to point out to me when it's time to do so. And that last one could be expanded upon, because what happens if the young man doesn't wipe his chin is he gets rashes from the excess saliva on his chin. And so the provider then would know, if I see this young man and he has rashes all over his chin, it doesn't mean that he's gotten into something that he's really allergic to. It doesn't mean that there's been an injury or an accident. It probably just means that the saliva isn't getting washed away regularly enough. Some additional challenges: I sometimes get anxious, upset, or uncomfortable, or my senses may become overwhelmed, and I don't always know how to tell you this. So deep pressure or joint compression applied to my wrists and legs calms me down and helps me focus. Wouldn't that be nice information to have if you're a new healthcare provider and you have this individual coming into your office, and it's a situation that's unfamiliar to them, anxiety-provoking anyway, and right here off the bat, you have some strategies that can help that person calm down pretty simply with the joint compression to the wrists and legs. Weighted blankets at night might help me to sleep. Heavy work can help, like hill climbing or pushing himself on a scooter, carpet, etc. Okay, and now we'll move into another. I'm just showing you bits from a variety of portfolios. So this is from a different individual. Some examples of this person's medical needs. Jason has pulmonary hypertension. He is on oxygen throughout the day, and his tank is filled every 2 hours. And on this slide, we did have a picture of the individual with his oxygen tanks, so that it would be really visual. You'd be able to see what size the tanks are, how he carries them in a backpack, etc. Jason has an auto subcutaneous pump attached to his abdomen, which delivers his heart medications, and then we could get more specific about what those heart medications are, the dosages, how often They need to be refilled, etc. At bedtime, Jason takes his medications and then connects to a BiPAP machine, which forces air into his airways at all times throughout the night. So just some different medical needs being expressed there. In terms of advocacy, Jason's a good advocate for his medical needs, and he will let people know about any difficulties with his oxygen supply, and he can help with filling the tank. He was in the process at this time of getting a cell phone that he could use in case of emergency. So again, letting the healthcare providers know about how much Jason can participate and how much he does participate in his own healthcare, and some of the strategies that are in place or being put in place to help him in case of emergencies. Some of the accommodations: Jason needs to sit down and rest every 20 to 30 minutes. He needs space for a large oxygen tank with which to fill his smaller tank, and he needs to have access to a telephone. So these are things that can help healthcare providers help Jason plan for his health and safety when he's out working in the world or living independently or going to school or whatever he chooses to do. This is a different individual's portfolio. They wanted to share information about sensations that really bother them. They're very sensitive to certain touches, certain sensations, and when they're exposed to these, it makes it hard for them to concentrate, hard to sit still, hard to stay calm enough to be present in doing whatever they need to be doing. So some examples are the feel of my hands scraping or rubbing on paper, when my hands get dirty, having my fingernails clipped, and being touched by others without my permission. So sometimes when you see this person, their fingernails are quite long, probably, I'm trying to measure here, probably a good, I don't know, over an inch, very long fingernails. And so if you see that in a healthcare setting, you might immediately think, what do we need to do to get these nails down to size so this person isn't scratching themselves and causing injury? But you need to know that having the fingernails clipped is really stressful for this person. So building in place a strategy, how do we do that in a way that doesn't create extra anxiety and problems in the office? Likewise, being touched by others without my permission. So it's very important to talk to this person first, let them know what's going to be happening, what areas need to be examined, how you're going to be touching, feeling, looking at them, giving them permission to say no if they're not comfortable with that, those kinds of things, because you know up front that that's an issue for this individual. Here's an example of a medications page in the portfolio and what that can look like. I take 30 milligrams of fluoxetine with my evening meal. I've taken this medication since January 2010. It sometimes makes me feel sluggish and tired. And ABC Pharmacy fills my prescription every 90 days, and once a year I see my doctor for a new prescription. So really quickly, there's a lot of information in bulleted format, easy for a healthcare provider to look at, to see the essentials, and then if they have additional questions, those can give you hints about things you might want to add to the portfolio for the future. Because again, you want to help people become their own healthcare advocates to the greatest extent possible. You want to help develop healthcare literacy, and so including information in there that will answer questions that might come up in healthcare settings allows the person whose portfolio this is to answer those questions themselves via the portfolio. Moving on to another portfolio. This is one of our former Montana Transition Training Information and Resource Center board members, Carly, and she's also presented at a number of webinars for us, a great presenter. And she was at one of our emerging leaders just a couple of weeks ago. So if you haven't seen her story on our website, check it out, an amazing young woman. In these pictures, I'm making choices about what to eat, choosing what to wear, and asking for breakfast with my Echo Talker. And part of the benefit of this slide is that it lets healthcare providers and other people who are meeting Carly know how she's able to communicate, that she definitely is able to make choices in her life, that she knows what she wants, and she is a good self-advocate for getting her needs and her wants met. And it shows a picture of her Echo Talker device so that if you're not familiar with that term, you can see what it is. The next slide could even be a close-up of the Echo and what the screen looks like so that whoever's looking at the portfolio can get sort of a closer view of what Carly sees and how she uses her echo. And then she wants to show a bit about her wheelchair and how she's able to use that to navigate her world. Her wheelchair, she says, it's very well fitted for my needs. I can reach to the ceiling. I can get into my closet for dishes. I can open the refrigerator and freezer. I have an elevator lift, right and left leg lifts, and tilt on my wheelchair. And then she includes some different pictures to show her navigating her environment with the wheelchair. Again, you don't have to include a lot of text. The pictures provide a wealth of information on a slide like this. And then Carly wants to introduce people in more detail to certain pieces of equipment in her home that are really essential to her health and well-being. And so she has some close-ups here. This is her Invacare air mattress for her bed. And she could include some bullets there about what specifically it does if she wanted to. Here's a picture of the hand brace that she wears when she goes to bed. She uses a bed control to raise or lower her bed and has an emergency alert button so she can call for help if she needs to. And then there's her Echo Talker. So those are all ways of really quickly introducing somebody new to Carly and some of the supports and strategies that she uses to help keep herself safe, to help keep herself healthy, to help navigate her world as independently as she can. And here's her phone that she keeps nearby, and she can call for help if she needs to. Moving on to another example. Here's a person who has some different ways to communicate. They hum when they're happy. When I'm worried, feeling threatened, or my routine has changed, I may have a meltdown, and what that looks like is I sob, hit the sides of my head, bang my head, threaten to hit others, pace. You can prevent or help me prevent these meltdowns by preparing me for changes ahead of time. If I'm already in a meltdown, people can talk me through it by reassuring me or distracting me, or sometimes gentle pressure on my hands and arms will calm me down. Same individual, certain smells and sensations bother him. The smell of ham and other meats can make him throw up. His skin is sensitive to some fabrics and to garbage bags, and he doesn't like his hands to be sticky. And so not only is this information valuable to new healthcare providers because it can let them know a little bit about this person, it can let them know that if the individual is getting really stressed out and anxious in the office, maybe it's because they have on an examination gown that their skin is really sensitive to. Maybe that fabric is one of the fabrics that bothers their skin. Maybe they have sticky hands when they came into the office because they didn't have a chance to wash before the appointment, whatever it might be. So it's useful in that sense, but it's also potentially useful diagnostically because over time a healthcare provider can start to look at these different qualities, these different characteristics, and perhaps start to say, well, you know, maybe some sensory integration work with an occupational therapist would be helpful to this individual. It helps round out the picture, so instead of just having a piece here and a piece here and a piece here of the puzzle, it helps to start pulling those pieces together in one place to give us a better, more comprehensive picture of what this individual might need and what's going on with them and what might be helpful for them. Here's a really short slide on medication and seizures. I take my seizure medication 5 times a day, and on this particular one they were not specific about what kinds of seizure medication, what times the dosages were administered, what the dosages were, etc. So that's all more information that you could include. My medication makes me tired. I have a history of grand mal seizures but have not had one in several years. So that was just one page that they wanted in their portfolio. They didn't feel like seizures were a big issue in their life anymore, but they were still taking a significant amount of anti-seizure medication, and they did have a history of pretty major grand mal seizures. So it was important to have that in the portfolio somewhere. Here's another individual's portfolio. Challenges I have and supports that work for me include I'm completely deaf in my right ear. I have a 50% hearing loss in my left ear. I sometimes wear a hearing aid, but when I do, sudden and loud noises startle me and I get headaches when I'm in loud places. I need help changing the batteries in my hearing aid. So bulleted, really important information, and then a picture of the hearing aid. My hearing aid looks like this. Continuing with that same individual, some of the challenges and supports that work for him. He says, I hear better if I sit on the right-hand side of classrooms or any other environment. It works best for me if you stand where I can see your lips as you speak to me, or if you speak into my left ear. It's important to be patient when you're trying to tell me something because it may take me several times to accurately hear what you're trying to say. Here's an individual who uses a feeding tube, and just they wanted to share information, and this one is actually just a generic photo of a feeding tube. I need the site around my feeding tube watched carefully for signs of infection, and they would want to include a lot more information about who hooks up the feeding tube, how often does it need to be monitored and cleaned, and all of that information, but this is just a basic intro to the feeding tube. This is a form that one of our other board members, Isaac Baldry, developed, and it's a little off the topic of healthcare portfolio, but it's a piece that can be included toward the end of a portfolio, or it's a piece that can just be done in conjunction with a healthcare portfolio. He and his mom, a designation for patient advocate for care, custody, and medical treatment decisions. And he and his mom developed this when he was turning 18 and was going to become legally responsible for himself and his health care and other decisions. He wanted his mom to still be able to help him with some of his medical care, his appointments and his medical care decisions that he needed to make. And so they created this form together. And it's just something that I wanted to throw out there for you to take a look at. They also, in an earlier presentation that Isaac did for us, they shared this form, or he shared this form with us, a Blue Cross Blue Shield form, just to remind young people to check with their insurance company to see if they have additional forms that have to be filled out so that someone can help that young adult speak with the insurance company on the young adult's behalf. So in Isaac's situation, he wanted his mom to be able to speak with the insurance company on his behalf, even though legally he was an adult. And so his insurance company had an authorization for disclosure of an individual's health information that he needed to fill out. So those are just, again, some add-ons, other pieces to be thinking about as young adults are transitioning into adult health care and, into the adult world in general. Before I go into some resources, I just wanted to do 2 quick polls with you to see if you're out there and still awake and what your experience with healthcare portfolios might be. So the first one is, have you ever used a portfolio for healthcare needs? And if you can answer that on your screen, we have yes, no, or I'm not sure. And so we'll give a couple minutes for the votes to come in on that. We have about half the people voted. And I'll let you know the final tally because I don't think you can see it on your end. Okay, give it a few more seconds. We have about 75% of the votes in. Have you ever used a portfolio for healthcare needs? Okay, looks like the voting has stopped. We have 25% folks, 25% of the respondents have said that yes, you have used a portfolio for healthcare needs, and 75% have said no. So for the 25% of you who say yes, when we get into the question and answer time, if you have any experiences with healthcare portfolios that you'd like to share with the audience, you're welcome to type those in and I can read them aloud to the audience if they're not too long. Or if you have any other ideas about things that you've learned through experience should be added to healthcare portfolios. Okay, so let me close that poll. And then I have one other poll. Based on what you've heard today and what you've learned about healthcare portfolios, do you think you might someday use a healthcare portfolio? And that's not necessarily for yourself. It might be for a child or someone you're working with or someone you're advocating for. So again, the answers are yes, no, or I'm not sure. Do you think you might ever use a portfolio for healthcare needs? We'll give a few seconds for the votes to come in on that. Okay, they're rolling in. We're getting close to 70% there. Okay, we'll give another couple seconds. If you haven't voted, go ahead and do so. Okay, I'll go ahead and close that poll. Great. Well, we see 79% of you say that you think you might use a healthcare portfolio at some time, and 21% are not sure, but nobody said no, so that's great news. And again, when we get into the question and answer time, if you have ideas, things that you would add to a portfolio, by all means share those and I'll read them aloud to the group. And I'm suggesting that you not raise your hand for questions when we get to the question and answer time, because we've had difficulty unmuting people to ask questions over the phone or over their microphone before. So I do ask that you type your questions into chat. But before we move into that, I have a few resources that I want to share with you. And again, these slides the recording and the slides will be posted on our website and on the Pluck Rural Institute Transition Projects website in about 2 weeks. It usually takes about that long to get the recording up. But then you'll have access to these website URLs there if you don't want to try to scribble them all down right now. There is an iPod app out there by AbleLink Technologies Incorporated called My Health, My Choice, and My Responsibility, and it includes some really relevant titles like Taking Charge of Your Health, Developing a Health Plan, Be a Health Advocate, Be a Health Self-Advocate, etc. So I've given you the URL if you want to take a look at that iPad app. The National Healthcare Transition Center has a fabulous website with all kinds of excellent resources on it. It's the gottransition.org website. I highly recommend that you go there if you haven't already been there. They have all kinds of really high quality resources available, and they also offer free webinars. They have a radio broadcast coming up, an online radio episode 1 called Why This, Why Now, and What Does It Mean for Me? And that's scheduled to take place on September 28th from 1 to 1:30 Mountain Time. It's something that you might want to take a look at. Go to their website, read more about it, see if it's something that interests you. It sounded really interesting to me. And their site has information geared toward youth, toward families, toward providers, and then some state-related resources. So again, that's a really good one to have bookmarked. If you don't go to any other healthcare transition site, I would sure go there. And here are some others that you can take a look at, and some articles you might want to read. The first is the National Alliance to Advance Adolescent Health, and I've given you their website. A transition guide that you can download. It's a PDF document. It's called When You're 18, a healthcare transition guide for young adults. The Montana Youth Transitions website has a health section that you can visit, and I've given you the URL for that. Supporting the healthcare transition from adolescence to adulthood in the medical home, and this is an article, a journal article from the American Academy of Pediatrics clinical report. Excellent article with some very concrete suggestions, so that's a good one to take a look at. And then Pluck, Parents Let's Unite for Kids, created several years ago the Montana Parents Handbook on Transition Adult Living, and there's a health section of that you can take a look at. It hasn't been updated in a couple of years, but there is still some good health-related information in there, things for you to think about in terms of health insurance, Medicaid, Medicare, etc. So it's definitely worth taking a look at. The 6 core elements of healthcare transition, this is from the Gott Transition and National Healthcare Transition Center and Center for Medical Home Improvement. You can take a look at what those 6 core elements of healthcare transition are. And then the last is Making the Move to Managing Your Own Personal Assistance Services, a toolkit for youth with disabilities transitioning to adulthood. And that's a downloadable toolkit that you might find helpful. So with that, I'd like to go ahead and open up the question and answer time. And on the screen in front of you, you should see the two websites I've been referring to throughout the presentation. The first is the Rural Institute Transition Projects website, and that's where we post information about our listserv, about the different webinars that are coming up, and it's also where we post the recordings from like today's webinar and any of the others that we've done. And the recording from today's webinar will also be posted on the Pluck Rural Institute Transition Toolbox. And so I've included the URL for that as well. You can take a look at both of those sites, and within about 2 weeks, the webinar should be archived there. So I'm going to go ahead and open up my question box so that I can see what some of the questions are that have come in, and I'll read them to you before answering. Okay, so the first question is, do you recommend including health insurance information, for example, health plan ID numbers, Medicaid info, etc., health plan contact numbers, frequently, because that information is frequently asked on intake forms? Now, that's a great question, and I guess my gut reaction is I probably would not include like health care, the health insurance plan numbers and Medicaid ID numbers and such directly in the portfolio, just because it feels like they're so visible. And I know that seems like an odd answer when you're including personal information about medications and seizures and those kinds of things. But in terms of numbers, I always get a little cautious about that. So, but that's really important information to have and to have on hand. And Isaac, who I mentioned earlier, had a fantastic plan for that. He just developed a little cheat sheet, and it included all of those kinds of pieces of information: Social Security number, emergency contact number, health insurance number, Medicaid number, etc. And he kept that cheat sheet in a safe place, but accessible to himself, so that he'd have that information at his fingertips if he needed it, but it wasn't quite as big as on a portfolio slide. I hope that makes sense and kind of answers your question. Next question, I think I would also include a list of daily activities, as doctors often ask about this, and definitely, and we, in our portfolios that we do on a regular basis, we include lots of pictures of daily activities, what volunteering things the person does, chores they do at home, how they go about getting through their daily schedule in terms of, preparing their own meals, or do they need assistance with that, getting ready for bed, how do they navigate the transportation in their community. We include slides with that information and with photos as well. And I apologize for not including those in today's presentation. We've done several other portfolio presentations that have more of that in them, and so I didn't pull some of those slides into today, but I should have. So I'm glad that you pointed that out. Including the list of daily activities, great thought. Can you give the health app again? I sure can, and it will be on the recording as well, but let me scroll back to that slide so you'll have it in front of you. It'll take me a minute to get there because I don't have the number in front of me. Okay, it should be in front of you now. My health, my choice, my responsibility. Hopefully you can see that. It's quite a long URL at the end there. You can also just Google My Health, My Choice, My Responsibility app, and it should take you right to the iTunes store. Or you can go to the iTunes store and search for My Health, My Choice, My Responsibility. Other questions? Give a few minutes in case you're thinking of any or typing. And for those of you who have used healthcare portfolios before, if you have any examples of situations or settings where you've used them, or other bits of information that you've included in them that you find really helpful, if you wouldn't mind typing that into chat, that would be great. Excuse me. Another question, I've heard that doctors sometimes want a copy of the guardianship form. Do you handle that like the insurance information? Typically we have, yeah, that the guardianship information, whatever that may be, and it may be limited power of attorney, it may be the medical advocate form that Isaac used, whatever it is, typically we would suggest that the young adult take that into the visit with them and not necessarily have it as part of their portfolio, because the doctor's probably going to want a copy, or the medical, the healthcare provider is probably going to want a copy of that to keep on hand in the file. And so it's nice if you just have a hard copy that they can keep. Other questions or thoughts or? I'm going to give just a couple more minutes in case people are typing, and while we're waiting, I'll tell you a bit of our closing information. Just a reminder that we do have the online evaluation, and we will send out the link to that online evaluation after today's call. It will come to you via email. It's a very short survey, and we really hope that you'll take the time to fill it out. We do pay attention to those, and we're always trying to improve the services that we offer, but we can't do it if you don't tell us what we can do better or what topics you'd like to hear about. So please fill out the survey. Our next webinar will be Identifying and Communicating Support Needs, and that will take place on October 18th from 1 o'clock until 2:30 Mountain Time. And the flyer information, registration information for that will be sent out to Montana Transition Listserv members. It will also be posted on our website probably about 2 to 3 weeks before the session. If you're not already on the Montana Transition Listserv and would like to join, you can go to our Transition Project's website, and there's a Join the Listserv box about halfway down the homepage of the website. Or if you filled out on the registration form for today's webinar that you wanted to join the listserv, I go through that list and I add everybody to the listserv who said they want to be on it and isn't already there. Just a reminder also that today's recording will be posted to the Transition Projects and the Rural Institute Pluck Online Toolbox websites. Any last questions or comments or ideas or thoughts? Okay, well, we're finishing up a little bit early today. We did have a young woman who had planned to be one of our presenters today, and she's actually a fabulous presenter and a great self-advocate, another one of our board members. We were really looking forward to having her here, but she also happens to be a very busy college student, and because the semester has just started, you know how homework tends to pile in and snowball at the beginning of the semester, and so she had to beg out, and that's why we're finishing a bit early, and I apologize for that, but school definitely needed to be her priority, and hopefully we'll be able to get her in here for one of the future sessions. Okay, and just one more comment came in about thanks so much. I think I'll also come up with some forms such as a medication schedule, questions to ask the doctor, list of supplements, schedule for blood tests, etc. Great suggestions, all of those. I'll read through those again in case you want to write them down in your notes because they're good ideas. Medication schedule, questions to ask the doctor, list of supplements, schedule for blood tests, etc. And these are all things that really could be helpful for anybody who's trying to take charge of and keep track of their own health care, because it can get pretty overwhelming to keep track of all of that. So great suggestions. Thank you very much. All right, well, thanks so much, everyone, for your participation today and for your attention. We'll get those evaluation links sent out to you, and we hope that you learned something that you can use today. Have a great rest of the week. Take care.